guys, let's have it.
Let's have it.
Like,
Share.
subscribe.
That's
To a
right.
mother that needs it.
Save a
Save
mommy.
a life.
Save a mommy, 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 save a.
Like,
Share.
hi, mama.
Hello, mamas.
Welcome to another episode of Strictly Moms by
Debs and Gabs.
And today we have a very, very, very special guest with us.
Yay.
My sweet girl.
Hello.
So we've been friends for over 20 years, but
Wow.
this woman has been in my life for the longest,
long.
you know.
Yeah.
2 decades.
Yeah.
That's awesome.
And that's even one side, on one side, but this is Dr. Nene Osafiana.
Not doctor by just doctor.
No, he's
Actual
not honorary
medical,
PhD.
medical
She's
doctor.
a medical doctor
Yeah.
by profession.
With
And
authority.
with authority, because she
Yeah.
practices in 2 countries, Nigeria
wow.
and Ghana. That's no
That's
small feat.
awesome.
And on top of that, this woman runs the female cycle. So she is passionate about everything female health.
Mhm.
Whether it's the menstrual cycle, whether it's menopause, whether it's
all those cycles around
postpartum,
women.
as long as it concerns a woman,
She's there.
ask
She's your
her.
girl.
She's your girl, 100%. So you're welcome.
Thank you. Thank you, Debs and Gabs.
Oh, you got that.
Okay.
Yeah, it's so good to have you on here
And
today.
I'm so honored to be here
Thank you
today.
for having me.
Okay.
So, mamas, one thing is we talk a lot about emotional things. We go into how it makes us feel as
And we
mothers.
rant about it.
And we rant about it quite a lot. So today
Yeah.
we want to know, is our rant legit?
Yeah.
Or is it not legit?
Legit.
Is it medically? Do we have a medical standpoint?
Yeah,
on this?
Is it okay for our husbands to say you're just making noise, or it's actually it's actually
It's
good.
valid.
It's valid.
Mhm.
Yeah.
So we want to hear from a professional, someone who's going to be speaking with authority on postpartum and everything around it. So yeah, we're just going to get right into it.
Okay.
So I think firstly, I want to know, as a doctor, in your profession, what do you see from women? What are the major things and what are the minor things when it comes to postpartum, when it comes to delivery, when it comes to just general, childbearing?
Childbearing. So in the medical field,
Mhm.
what I see is a mix of emotions. It's like it comes in stages. It comes before delivery, it comes in the I just want to get over this with I'm in pain. I want this to go. After delivery, it comes with the rushing of happiness.
Yeah.
Everybody's congratulating you and you're fine and you're okay. And a few moments after that happiness
A few moments later.
comes in a little bit of
What did
drop
I
of
just-
energy.
Yeah.
It's like, am I ready for this?
Yeah.
Oh, wow.
I've had moments where I'm in the neonatal ward and some of the children admitted maybe in the sick baby units. I've had situations where I come because normally just initiation of breastfeeding is within an hour after delivery, whether CS or
Wow.
or vaginal delivery. It helps with bonding and it also helps with the child's the immunity and everything.
Wow.
So I've had situations where it's been 24 hours and I ask, has this baby been fed? Because surprisingly, babies have this thing they do where they keep pouting. Yes.
Yeah.
And I see it a lot and I'm like, has this baby been fed? They said, no, mother just had CS and has not come. I'm like, okay, take the baby to the mother. And sometimes they're like, mother is not ready to breastfeed. Next question is that she's not producing breast milk. They say, no, she's not ready to breastfeed.
Wow.
So then I understand that this is not about the physical, it's about the emotional. So I try in my best capacity to look for her partner, speak with the partner and see how we can help her emotionally. And also introduce the mental health community or the department in the hospital to also speak with her about it. Because the thing about milk letdown is that it's, yes, hormones are affected and everything, but at the same time, emotions are affected because
Oh, wow.
stress can actually cause,
Play part.
yes,
Yeah.
it can make milk let down not to come because she's stressed,
Wow.
and it could come from emotional stress, physical stress. So that's why I say it's like a mix of emotions. We have some mothers who actually go through the whole thing, they're fine, they're healthy. After 24 hours, if there are no complications, we discharge them to go home. Then you come back maybe in 2 weeks for just the normal review,
Yeah.
and then we send you home again, you come back again. But there are some of them that struggle. And for me, it's those who struggle that will I say they are of more concern.
Yeah.
Not to leave out those that are going happily, because as time goes on, they might end up
Yeah.
going
You know,
into the
being in that same
yes,
shoe.
they might end up going into the stage where they are struggling. And that's when I tell not just the partner, but those around them, support her. Because the whole 9 months is not even the whole 9 months. Before conception, it's always a mix of hormones. It's not like women are making up, I feel
These
sad, I
things.
feel,
Oh, wow.
the
Did you hear
hormones are
that?
there.
She's not
It's
making
not
it
made
up.
up.
She's
It's
not making it
made
up.
up.
Yeah.
Oh,
Wow.
I feel this, I feel that. Progesterone is there, estrogen is there, and they keep going up in circles. So that's like
Is there ever
the
a
whole.
break?
I feel seen.
Yeah. Is there? Do we get a break at any
Yes.
point in time where hormones are not playing a part
No,
in our journey?
I don't think so, because we have 4 phases in this our cycle. And if it's not about pregnancy, it's about the menstruation, which we all experience
Yeah.
if we're not pregnant.
Mm-hmm.
And that 4 phases, each hormone has a role to play. We have the parts where ovulation is there, the hormone spikes, which causes the ovulation. You know, you're joyous, you're more sexually inclined and everything. Then you now have the luteal phase just before your period, where you start having all these mood swings.
Crankiness.
And it's like every
like,
little thing pisses you
gets
off.
to you.
And
And this
funny,
is, doctor, please.
Mhm.
This is a real thing.
It is a real thing.
We are not mad. We are not just
No.
getting
You're
in
not
our
making it up.
heads.
No,
Because
no.
I mean, they make it sound like I beg you.
Are
But
you
it's
are you
not
the
a beg
first?
you.
No,
There's
it's
a
not.
thing. Yes,
And
why
it's not to even it's not even to say, oh, it's not a how do I put it? It's not
approval to just
justification for your bad
behave?
behavior.
Yes.
No,
Yeah.
it's not justification for bad behavior. But it's just
But
it's
they
it
call to be
helps.
graceful if you have
Yes.
a woman in that stage of
Exactly.
things
It
right
helps
now.
the partner or whomever is around to be
Exactly.
more sensitive. And on the other hand, as a woman, you know that okay,
This
this
why.
is why, this is how I
Yes.
would manage it and all of that.
Uh-huh.
So that you don't just, get mad at somebody
Yes.
and then
Yes.
think that you are the one who is the drama.
Yeah, exactly. So it helps to know your body better, to know what helps you better. At the same time, it helps to guide your partner to know what works better. So it's like now, I have a partner who follows up with my cycle, and he knows my phases. He knows that if I'm in luteal phase, he's going to try his possible best not to irritate me or get me pissed off at the littlest idea. Or if I easily get angry, he'll know that okay, let me just be patient with her. This is what she's going through right now. So that kind of understanding, it also plays a part after pregnancy, even plays a more like
Vital
more
role.
yeah, because this is a situation where a woman, if I'm talking about first time mothers now, this is a situation where you're moving from taking care of just yourself and your partner to where you are taking care of a child that just came out from you.
Yeah.
So it's like I see people at some points, it's like they want to have this reason of neglect, but they can't. They can't. And sometimes that kind of thing can frustrate you. But I believe that when emotional support comes in, it helps the mother, not just physically, but in her mental state. And helping the mother, indirectly helps the whole community or the
Of
family.
course.
100%.
Because now you're helping the mother. Mother is sound enough to raise this child well so that child won't be a nuisance to society.
Wow.
Mhm.
Mother,
I love
That's a
that.
whole cause and effect
Yes.
thing, and
She's
it's
exactly.
able to speak
huge.
life into her baby
Yeah.
without cursing that child. So
Exactly.
this actually brings me to my next question,
Mm-hmm.
right? So it's about the 6 weeks postpartum checkup.
Hmm.
Now, usually you go to the hospital and like we would say, is everything okay down there?
Yeah.
Are you doing fine? Okay, you can start having sex again. And that is the end of the conversation.
Usually.
But from what you're saying, it seems like this conversation should be more.
Yeah.
Yeah.
It seems like there should be like a physical and mental. And if there's one thing I know,
Mm-hmm.
you don't get to see a psychologist. I don't know about your hospitals, but I didn't get to see one
I didn't
after
see
those six
one.
weeks.
I didn't see one.
Mhm.
And there's the whole conversation of, oh, you're still feeling this. It's just psychological. Okay, yes, it's psychological, but how do you help me get better to be able to do the things that I want to do or that I need to do or that is expected of me?
Mhm.
It's psychological, but how do I work through that? I've never been here before. I've never done any of these things. So, doctor, you're here. How do you help
How
our
do you
mamas
help
out
us
there?
save
Who
a
have
mommy?
Save a mommy.
okay, so if it comes to the psychological aspects, we all, when it comes to psychology, it's your mind. The mind plays games with us, and your mind can affect your body.
Hmm.
Your environment can affect your mind also. So if you come to me, I'm doing a follow up on you post delivery. I ask you the basic question, general questions, how your health is doing physically, and also how you feel
You're healing fine and stuff
exactly.
like that.
And then you tell me you've not been okay psychologically. I will take my time because we have patients that they're fine, everything is okay, and then they go, next person comes in. So if you mention that, we can go deep into a minor conversation. What's the problem? Where is it coming from? So it's like we're trying to do a problem solving situation
Therapy
to
sort of thing.
figure it out. And what I usually advise some of the patients I've seen in that kind of situation is that they get a book. So it's like writing also helps. And if you're trying to,
Jot things down,
if you
mama.
feel like you don't know what is going on, get a book. Whenever you have that mood swing, just put a series of events that has happened before that mood swing, so that you can now go over the whole thing and then now
To be able to
be like,
locate.
okay, this is the common denominator, or this is the common thing. So this might be the issue. So once you have the issue, you'll be able to tackle what the issue is.
Yeah.
If the issue is that you're no longer getting that affection from your husband or from the family, then as a person, I think you just need to build up confidence to speak with your partner. Babe, I don't like how this is going with us ever since this happened. Communication should just be there. Or you speak with your parents. I don't like how people are always trying to butt into my decisions as a mother because you have experienced it.
Okay.
So
That's what
aside
doctor said.
Butting in,
Do you
butt
hear what
out
the
a little,
doctor said?
please.
so as much as you found the issue, you also need to take up courage has on like within yourself to be able to tackle that issue.
Yeah.
Because has like sometimes help can come from outside, but help starts from you
Yeah,
as a
Mhm.
person.
100%,
Mhm.
100.
Yeah.
I love that. And I
Help
think this
starts from within.
yes, help
Yeah.
starts from within. And I think that even gets to the point of being confident enough to tell your doctor, I'm not okay. Because you know, in our African setting, they wouldn't ask you. It's not one of the things they will ask you postpartum. Are you okay physically?
And it's not very often.
Yes, it's not very often
There
that they
might
would.
be people doing that, but it's not
Yes,
very often.
in my experience, I wasn't asked.
Yeah.
And I don't know if you were in your
No,
experience.
I wasn't asked.
Exactly. So
They just want to know, oh, physically, is it healing? Are you still bleeding? Da 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 da. You know, the check marks.
Yeah.
The physical check marks, but nothing mentally, emotionally, or
exactly.
psychologically.
So if we're not in a society that the doctors are already doing that, let us as mothers. So if you're a pregnant mama and you're getting there, know that you should be confident enough. And if you're just, in your early stages of postpartum or even later, be confident enough to say, I'm not okay. If no one in your house is listening, no one in your home is listening, go to the hospital and say, I don't think I'm okay.
Yeah.
And like she said, keep a journal. It would help you to track your mood so that you're not just saying, I'm not okay, and then they're asking you
What
what.
is the problem? And I think that that's something that happens with us. We are not able to say, okay, this and this. And so this journal, this, what she said, what she has shared is a very big thing. To be able to journal, okay, this led up to this happened. Within that thing, you find a resolve.
Yes.
Yeah.
Most
You may
of
not
the
even need
time.
to go,
Yes,
find
you find a resolve when
yeah.
you can journal,
Mm-hmm.
what has transpired
Yeah.
But
so
but
far.
this what's at what point, when is it too much? Because like we're saying, when in society people are not
It's
speaking
never
up,
too much.
No, I mean, when is it dying or die?
Hmm.
Something needs to be done because
Hmm.
yes, from what we can see from our mothers, right?
Mm-hmm.
Some people coast through it. And maybe at some point in their head they can be able to raise their heads up water to say, okay, I'm okay now. But when should you see a mother to know that okay, this woman actually
To intervene, or
To
yes.
intervene.
she's already in a
Um.
dicey position with it.
So
Mm,
at that moment, it will still depend on you. The moment when you realize that how you're feeling is affecting everything, it's affecting taking care of your child, communicating with people, balancing your life with career and everything, you can find someone, maybe a mother like you or someone who has delivered also, and ask and have a conversation with the person. When you started feeling like this, what did you do?
mm,
If
Hmm.
that person replies you, I just let it go. We are all different people, and we all, will I say, we relate with trauma or
Hmm.
anything
Differently.
differently.
mm-hmm.
So if you don't find something that works for you, I think that is where you can take it upon yourself to see a psychologist. Sometimes you might actually see a medical doctor, general practitioner, and everything, and some of them might like just dismiss it, but it's left to you to keep putting it, because you just can't dismiss something
Mm,
that is causing like a huge effect in your life. So if this doctor dismisses it twice, you can ask another doctor,
Hmm.
yeah, I love that.
that kind of thing. So
Hmm.
don't just feel like because one person has dismissed you, that's
Yeah.
the end.
Mm,
So in other words, don't be silent. Ask questions. If a community you're not getting the answers you need, know that it's okay to keep asking until you're heard,
yes.
because
Mm-hmm.
that can actually save a mommy.
Yes,
Yeah.
100%.
Mm-hmm.
Yeah.
Yeah. Um, I want to know,
Okay.
when is it too early to have the second baby?
Hmm.
This is both for C-section moms and
And
for vaginal
vagina
birth.
as well.
And then, when is there anything like too late for next baby? Because I hear things like, oh, because she waited, her gap was so much
Mm-mm.
after she had her baby. That's why she's struggling with this next
So
pregnancy.
mm-mm.
What's that about?
There's no fixed time to prepare yourself to have a next child.
Hmm.
There is no appointed time to have a next, and the duration you take before having the next child does not affect your fertility.
Hmm.
Mm,
So there's this term we have subfertility, but we are all, I think, as a community, majority of us are common with infertility.
mm,
But subfertility is when you've had children before, but now you are struggling.
Hmm.
And subfertility is not centered only, fertility itself is not centered on the woman.
Yeah.
So if, let's say, you and your husband, you've had a child before and you're struggling to have another child, there are a series of tests we run, and there are a series of conversations we ask. How often do you have unprotected sex a week or in a month? How often do you do this? Like we start doing the whole reproductive
yeah.
checklist
Hmm.
and all that. And if we find a problem with you medically, we treat it. However, if we don't find a problem with you medically, with you or your partner,
Yeah.
then we start moving into the psychological reasons.
Mm,
And if still no psychological reasons and everything, we just give you the hope of reassurance as to continue.
mhm,
But there is no fixed time left for you to have a second child, third
mm,
child, or fourth child.
mhm.
And the duration does not determine how fertile you are enough to have the next child.
But is there anything too early?
No, there's nothing too early. So the too early part comes with the family planning, which I believe it happens with the couple. If you've told yourself, oh, we want the family planning to be like a 2-year gap, 1-year gap,
Oh,
that's it.
3 months
You
gap.
work with it.
3 months gap, 2 months gap.
Too early, the only issue with too early, like maybe if you have like a year gap, is the toll it will take on both parents financially, physically,
Thank
and
you, ma.
all.
She's even going to 1 year gap. We were talking about people that are looking for 2 months gap, 3 months gap.
No. The thing now about the body healing is that see, breastfeeding is also a form of family planning. Once you're breastfeeding your child, and you're supposed to breastfeed exclusively for at least 6 months. At least 6 months, at most a year, or more than. No, at most a year. So if I should see a mother who has conceived 2 months after delivery, the first question I ask is, are you breastfeeding, like exclusive breastfeeding? If she says no, then it's most possible that's the cause. Then I counsel her, and she just has to prepare her mind that this is just going to take more work on her, because in 9 months she'll be having a newborn and her body will go back into healing. So she needs to prepare herself physically, mentally, financially, everything generally, in order to make sure that she's okay, both children are okay, and every other thing. So it's more of couple counseling. Then after that, we counsel for family planning.
Okay.
Have to choose a method.
A follow up to that is, when is it okay to start trying? Say everything is checked, they're ready mentally, emotionally, medically. When is it okay to start trying for baby number 2?
Roughly within a year or two. If
Wow.
everything is okay.
Yeah.
Okay.
If everything is okay mentally, a year or two.
Okay.
Okay. You heard
Because
that,
You heard that?
guys.
I don't even
Yeah.
well, for the mamas as well. I hope you heard that. But
Yeah.
for
Because
their
sometimes
husbands,
it's not just the husband.
yes, the women
Sometimes
want
the
it
women just. Do you know that there are
urgently.
women who enjoy pregnancy?
Wow.
There are women who enjoy being pregnant, all the things that come
Yeah,
with it.
they say, oh, you missed this pregnancy. No,
Yes.
I don't think
So
I've even at any point so far
say
in
like,
my
oh, my
over
bump.
six
They will say,
months.
oh, I
Yes,
miss my
you
bump.
miss your
Yes.
bump. No, I don't.
Yeah. So there are women who do that, and that's why they will want to, get pregnant again. And sometimes maybe they're just not in the right mental states. So they're like I just want to do this and get it over with. That is also there. So guys, please, you've heard from our doctor, and we
Yeah.
hope to have more of her around.
Yeah.
Thank you so much for coming. Mamas, this is on the medical side. Get more information. Get, know what is happening to your body, know what is happening around you, know what is happening medically to your how you are growing mentally as well, so that you know how to check yourself.
Yeah.
Don't leave it to chance, don't leave it to when it's too bad.
Yeah.
There is a lot of information out there, and you can absolutely lay your hands on it.
I know that for us here at Strictly Moms, we have doctors like Dr. Nene that are on call, and they are open to, servicing your questions, your
Absolutely,
needs, and all of that.
100%.
So if you do need that kind of help, if you do need that kind of medical attention, please do reach out to us, and we will put you through to the services that you require. Thank you.
Thank you. Until next time, we remain Strictly Mom by
Debs
Debs
and
and Gabs.
Gabs. Bye,
Bye.
mamas.
Hi, guys. We hope you enjoyed this episode.
Yeah.
Don't forget to like,
Share,
subscribe,
comment,
and don't forget to share
Send
to
to
a
your mom.
mama who needs this, because it is a community building, and it is what is going to save a life. Thank you. We love you. Mwah! Bye.